And on this Thursday, August the 5th, let's all listen and enjoy the conversation today, headed by Sara Donkersloot. Good morning, Sara.
Good morning, Gary, and I am delighted to have Toni Bulthuis, who's the immunization team supervisor at the Ottawa County Department of Public Health, with us via Zoom. And she's going to talk about something that's really relevant because school is going to be starting in the next month. And as parents of school-age children look toward fall, we're going to talk about vaccinations and the need to get them and what will be required. So, Toni, just a delight to have you on. Good morning.
Good morning. Thank you for having me. We appreciate it.
So, Toni, what is your role at the Ottawa County Department of Public Health?
I'm the immunization team supervisor here. So anything related to vaccines for children, adults, that need it. So and throughout Ottawa County. So I help work with private providers within the county and help with education. And we vaccinate here right at our clinics.
And what do you enjoy about your work? Probably just all those interactions with those different groups of people.
Exactly. I started here as an immunization nurse, so I just enjoy the interaction with children. I'm a pediatric nurse at heart. That's where I started my career. But I enjoy, yes, the collaboration with other local health departments and with private providers, our hospitals, and I just really enjoy knowing that what we're doing is making our community healthier.
So before we discuss vaccines that are required for school-age children, I just want to ask some general questions about vaccines. So how does a vaccine help our immune system work better?
It actually just helps our immune system work, is what it does. It helps our immune system do the job by fighting off bacteria and viruses that we've been vaccinated against. So vaccines are made from a weakened or killed bacteria or virus. And once that's injected into our muscle or sprayed into our nose or ingested, kind of like, different routes for different vaccinations can be, our body recognizes that, it makes immunity to it so that if we're ever exposed to that disease down the road, it has an immune defense and it stops us from getting very ill from that.
So, Toni, are there some stats out there that show how many lives are saved each year because people are vaccinated?
There are. Some of them are, really recent in the last couple of years, but they've helped us significantly reduce the amount of vaccine preventable diseases in our community, the U.S., the world. And there is a study from a 20-year span from 1994 to 2013 that in the US, routine childhood immunizations prevented or estimated to prevent 322 million illnesses, which is 4.1 illnesses per child, 21 million hospitalizations over the course of the lifetimes, and prevented 732,000 deaths from vaccine preventable illnesses.
Wow.
So it's huge. And there's a lot of studies that show that, not just that one.
So the question is, how long does it take to develop immunity when you've received a vaccination? Because, we're looking at school and, that's coming close. Parents and grandparents should have their kids getting those shots, shouldn't they?
Absolutely. It usually takes anywhere from 7 to 14 days for our bodies to create that immunity. So that's why we usually say it's a full 2 weeks, just to, everybody, it takes different bodies, different times. So we want that full 2 weeks before they're complete, to have complete immunity.
Okay, so children are going to begin school in the next month. Vaccines are required to start school. That's correct?
That is correct, especially in Michigan. And all 50 states have vaccine mandates. Some of them are a little bit different, but as to what vaccines are required, but all 50 states have vaccine mandates for school.
And just give us a little rationale. Why do states mandate vaccines?
It's really just to decrease the spread of childhood illnesses, because we know what schools are like, right? I mean, kids are in school with runny noses and we think it's allergies or red eyes, and it could definitely be. However, a lot of vaccine preventable illnesses are carried in our bodies and we're spreading them before we know it. And so it will reduce the amount of days that children are out of school. It will reduce the amount of illnesses that are spread between families. It'll reduce the economic impact of all the amount of healthcare dollars that we're spending. Parents won't lose days off of work. So there's many benefits to having kids who are in school vaccinated.
So, you mentioned that 50 states have mandates. So I'm assuming that parents or grandparents who have custody of their grandchildren need that certificate of immunity to enroll their child. Is that correct?
That is absolutely correct. So there are certain times when they have to have that. So what that would be is a new enrollee to a school. So that would, anytime they change schools or coming into a school district, they would need that certificate. They would definitely need it at preschool, at kindergarten, and 7th grade, because those are the reporting years for the Department of Education as to how many children are vaccinated in the schools. And so those are definitely the years that they have to submit that certificate of immunization. And those are also years where the requirements change a little bit in schools as to what vaccines are required.
So where do you get that certificate of immunization?
They can get that from their private provider. So their primary care physician is a good way to do it. If they, are new to the state or the county, if they're new to the state, we ask that they bring it from their previous state, from their previous physician. Local health departments like us, we're a great resource for them to get their immunization records through the Michigan Care Improvement Registry, we call it MICR. And so it's our state registry, and all children under the age of 20, physicians are required to enter into that registry.
Okay, so let's talk specifics. So, you mentioned, preschool, that age is a key year. So what vaccines do children age 4 to 6 need to have to start school?
That's kind of in a large age group, just because of the fact that they could be going to preschool, they could be going to a kindergarten program, they could be going to a Young Fives program, or they could be going to kindergarten. And so that's where this age group is kind of large. So for preschool enrollment, they would need to have an up-to-date series of DTaP, which there is their diphtheria, tetanus, and pertussis, a PCV13 series, which is a pneumococcal conjugate, Hib, which is the H influenza B series, polio, MMR, which is the measles, mumps, and rubella vaccine, hepatitis B, and varicella, which is chickenpox. So for kindergarten, though, which would be anything that has a K in it, a pre-K, a DK, a Young Fives, that is all of those mentioned above that I just mentioned previously. However, 2 of them drop off: the Hib, which is H, and the PCV13 pneumococcal conjugate vaccine. Those come off of the kindergarten requirement because kids over the age of 5 have a little bit less of a risk for that. So it changes a little bit per grade within that 4 to 6 age range.
Okay, so we're looking at those vaccines that are required. What about the flu vaccine? We hate to think about that. Is that recommended for this age group? And if so, when should it be administered?
Flu vaccine is recommended for anyone over the age of 6 months, everybody, school children included. It's not required for school, but it is highly encouraged, highly recommended, because flu can be very dangerous for kids and for infants. And so that's where we, especially being in schools, we know this kind of like with COVID, it spreads quickly. So flu vaccine is recommended. And anytime in the early fall is a good time to get that. So, September or October, anytime before that flu season can kick in, which we know can happen anywhere from like late November all the way through, we've had May outbreaks of the flu. So we just want to get fully vaccinated before the flu season hits.
So, okay, as protection from childhood vaccines wear off, what additional vaccines are needed for adolescents? You talked about that age bracket. I think maybe you said 7th grade. What vaccinations are needed?
Around that 7th grade age, so it's 11 to 12 years. That's when new ones are required for school. Newer, we get the Tdap at that age, but that's just a booster of the DTaP, that diphtheria, tetanus, pertussis vaccine that they got as, the last dose previous to that was probably around kindergarten age, but it's a booster at that teenage years or preteen years. And then there's also a meningitis vaccine, which there's a 4-strain meningitis vaccine, which protects them from the meningitis bacteria that can cause illness that unfortunately it goes very, very quickly and it looks like the flu. So these are things that are kind of scary for parents, and we want to make sure we're protecting kids, and especially at that age range that they share everything. They've got sleepovers. They are, sharing pop and, silverware and utensils and, all of these things. And so that's where we look at that and say, this can be the age range where that meningitis risk goes in. So it's the Tdap and the meningitis at that 11 to 12-year-old range. And then we also really highly encourage the HPV vaccine at that age, not required for school, but it's definitely highly encouraged before there's an exposure.
So the Ottawa County Department of Public Health, you're probably gearing up to give vaccines, correct? You give them, and if so, what is the cost and where can people get more information?
We are very busy right now, absolutely. And I'm sure doctors' offices are too. This is the time that they have to catch up on school immunizations. So we here at the Ottawa County Department of Public Health, we will see children who have, specifically for children, but who don't have insurance, are underinsured, like they don't have insurance that covers vaccine costs, or those who have Medicaid and don't have a provider that provide VFC vaccines, which is a government program for free vaccines. And so that is a program that some of the offices don't have. So all of those children can actually come to us and get their vaccines. And so, even if somebody moves here to Ottawa County from, somewhere a different state and doesn't have insurance here yet, we can definitely see the children and give them vaccines. It would just be something that we'd have to talk to them about and pay out of pocket and get reimbursed from their insurance company. But we will take all questions in regards to that.
And how do people make it? Do they make an appointment, or where do they call, or do they go to your website? What's the best way?
Definitely give us a call. We have great people on the phones and give them a lot of good information. Our number is 616-396-5266. And that works for any of our, sites. So it's just one main number, or our website is miottawa.org. And we have a lot of good information on there too.
We have about 2 minutes left, Toni, and I have a lot of great questions. I think maybe I'm going to ask you to come on again, because I really wanted to talk about some myths about vaccines, which I think would be really interesting, but we're not even going to get into that. But the question would be is, how long does it take? And I mean, how many vaccines can you administer at one time? You gave quite a list there, what is required for school. Is it more than one appointment? Is 2 appointments? How does that work?
It can be all done at one appointment. And this is because, a lot of people think vaccines, there's too many given at once. And it is kind of scary when your kids might get 4 or 5 shots at a time. But our immune systems are bombarded every day with thousands of bacteria and viruses. It's constantly working. So the amount that we're getting in a vaccine, or your child is getting in a vaccine, is very small compared to our whole environment. What they eat, what they put in their mouth, what's on our skin on a normal basis. So all of that is, what our immune systems are doing every day. So the amount that they get in vaccines is very tiny, but it's also more efficient nowadays than what even we got years and years ago. They get less antigens and they work better.
And again, what's the number that people can call to schedule or get more information about vaccines?
It is 616-396-5266.
Toni, thanks for all the Department of Public Health in Ottawa County has done through COVID and now through this vaccine. And thanks for sharing your expertise. Until next week, Spectrum Health Zeeland Community Hospital wishes you well.